Good morning to everyone who's just joining us for today's webinar. We're going to begin in a few minutes just to allow extra time for any latecomers. So we'll start in about 2-3 minutes. Thanks. To those just joining, we're going to start in 2 minutes. You good to go, Paul?
Yes, sir.
All right. Let me share my first screen. Hey, so good morning, everyone, and welcome to today's webinar. My name is Paul Nebb. I'm the CEO of Titan Technologies. Joined today by special guest Paul Reddick of Compliancy Group. Today we're going to talk about your practice, your medical practice, IT security, HIPAA compliancy, and how that all felt together. And Paul's going to really help us out a lot with that. A little bit about myself again. My name is Paul Nebb, CEO of Titan Technologies. We're an IT managed services security organization here in Central Jersey, located in Freehold. But we have clients throughout the state and throughout the region. We do a lot with helping both businesses and medical practices to be cyber safe. As you know, it's challenging right now. There's all sorts of different threats out there, and as well as technology is constantly evolving. And so we wanted to bring in the experts here at Compliancy Group to share a little bit about what they do for medical practices and how we work together to keep your medical practice compliant. And so, Paul, I'm going to stop my share here and turn it over to you.
All right, Paul. Love your name, by the way. Great to see you, sir. It's a pleasure to be with you this week. My name is Paul Reddick, for everybody that doesn't know me out there. As he said, I'm with Compliancy Group. I jokingly say I'm Vice President of long titles at Compliancy Group. I'm Vice President of Partner Engagement and Cybersecurity. The partner engagement is really what I'm doing right now, working through partners like Titan. We help provide compliance services to the medical community. And then the other side of it, the cybersecurity hat that I wear, the expression, those who can't do, teach, that's me. I'm not an engineer. I have made a career out of turning nerd into English. So hopefully between Paul and I today, we can teach you a little something and not go too far off the deep end and nerd you out. So I'm going to go ahead and start sharing my screen. As Paul said, we are going to go through a little bit of information today around kind of the place where compliance and security come together. So now, if you're not familiar with Compliancy Group, who we are is a player in the healthcare space that has been there. We were founded by HIPAA auditors over 17 years ago. We work with organizations of all shapes and sizes, from individual, mental health professionals up to large EHR companies. We work with people like voice over IP providers, MSPs, IT service providers, but we also do a lot of work with the business associates like attorneys and the support staff for all of this medical environment. The seal of compliance that you see on our website right there, or on the slide right there, what that is what you get when you go through our process. If you go to Titan's website, for example, you click on their HIPAA page, you're going to find that seal. What that means is that they have worked with us. We, as a third party, have looked at their HIPAA compliance program. We've looked at their cybersecurity. We have found that it's in line with the law, that it's not only in line, but defendable under the law, and we can prove it. That's when we issue out that seal. That's why Titan really works with us, right? Because Titan is passionate about their clients. One of the things that Paul Nebb realizes that a lot of IT providers do not is that cybersecurity alone does not protect you from the HIPAA law. Cybersecurity alone is not enough to keep you safe if you're a medical provider. And so they use us as that third party to protect you, their client base. Now, also, let's be real, HIPAA compliance is very complicated. It is a 700-page law written by lawyers to be audited and interpreted by other lawyers. It's not something to take lightly, and it's not something to wade into if you don't understand it. What Compliancy Group has done over our history is take that and make it something both manageable and easy to implement. So Titan chose us because after looking at a lot of different programs, I think one of the universal truths was we were easier than a lot of the other things, and it meant it can be done not just by them. They can handle the cybersecurity for just about any company in the country, but it's easily implementable by their clients that don't necessarily have the same understanding that they do. And let's be real, you guys are on the webinar today because Titan doesn't look like other IT providers. Titan doesn't feel like other IT providers. There's a culture of compliance. There's a culture inside Titan that says, what we do it right. We partner with the right people to bring them in and make sure that all of this stuff is taken care of. And ultimately what that means is that they're committed to protecting their clients in the healthcare space, in the medical arena, period, and all the business associates that support it. And for that, I will say again, Paul, thanks very much for having us on. And thank you to that commitment for safety for the medical community. It's underserved and way underprotected.
Really important stuff.
Again, I'll tell you a little bit about who we are as Compliancy Group. Like I said, we were founded 17, now almost 18 years ago by HIPAA auditors. So if you go back then, what we were actually doing is we were going out to really large organizations, Tennessee Department of Health, Kaiser Permanente, LA County, for example, all 12 hospitals and 1,300 clinics. So what we would do back then is we would go in, we would tell you everything that was wrong in your organization. We would get a big 6 or 7 figure check. We'd come back a year later to do it again, and believe it or not, everything was still wrong. The thing is that a risk assessment, a list of the things you're not doing right, is not a roadmap to fixing your problem. It's just a list of your problems. We started to realize that no matter how sophisticated or large the organization was, they didn't understand compliance, and they needed help turning what was just a risk assessment into an actual program that could achieve compliance with the law. So we built a solution. We actually took a tool that we had used forever to track this problem, to build these assessments. It's called the Guard. It's a software tool. For everybody out there, if you want an analogy, it's like QuickBooks, but for compliance. We built out this tool and started to create it as a leave behind, something where we could say, look, this is everything that's wrong. This is a list inside this tool of what you have to do and tasks associated. Knock it out. Paul, believe it or not, we would come back a year later. It was all still wrong. They still weren't doing it, because just like QuickBooks, if I give you this software, say knock it out, and you don't understand the law behind it, you don't understand the rules behind it, you're just not going to know what to do with it. So we created what we call HIPAA coaches. If my software is QuickBooks, they are accountants. It's a human being to make sure that what you're doing is correct. The stuff that goes into the system is right and validated. And ultimately, that coach, when you work with us, is the person that issues your seal. Paul here has a dedicated coach, both for him and for all of his clients. And that means that there is a single person that is going to look at this stuff, make sure it gets done right, and provide any guidance or assistance in the process. If you fast forward till today, that combination of a software tool and that methodology with the coach is why that seal of compliance that you see there is endorsed by like 40 plus major medical associations. So if you're out there and you're a dentist, the American Dental Association points to that seal and says, that's our only recommended solution for HIPAA compliance. So does the American Optometric. So does the American Chiropractic, and dozens and dozens and dozens of vendors, both in my space and yours, okay? That validation, that thing that it does for them says, look, it's not a government seal of certificate. It's not a certification that the government issued and said they're validating you. It means that a third party is willing to defend you. And I'll throw this out there. In the 17 years we've been doing it, as long as we've been issuing that seal, no client with that seal of compliance has ever failed a HIPAA audit. It's not because bad things haven't happened to some of our clients. Sadly, they have. However, if you get that seal, we defend you under audit. We will not give you the seal if we cannot defend you. Now, before we go all the way down this rabbit hole today, we need to get something out here. Paul is in the business of security. I am in the business of compliance. They are not the same thing. People get them so confused all the time. I'm going to try to break this out for you. Compliance is about a law. It's binary. And what I mean by that is if you are driving on the road and the speed limit is 55 and you do 56, believe it or not, you are in violation of the law. The law doesn't have allowance for variance right there. It is either you are under the speed limit or you are over the speed limit. You are abiding by the law or you're breaking the law. That is the way compliance works. It's the technology inside compliance is deliberately vague because it's written for an entire industry. So let's leave healthcare for a second. Nike and Boeing are both under SOX compliance. They're publicly traded, they're massive, they're huge. The law is written for the two of these organizations equally. And according to the technical standards and compliance, they're going to look and feel very similar. And if you screw up with compliance, you're going to get fined. You can even have legal sanctions against you. It's what the government does to punish you. Security, however, Paul's job is risk management. It's not equal for everybody. Back to Nike and Boeing. Nike makes tennis shoes and Boeing makes missiles. It makes sense that Nike gets to run out of money for security before the missile manufacturer, okay? That's the way security works. Paul is there to look at your specific organization, look at the law and say, look, all these gray HIPAA standards and security here, based on your risk profile, this is what I as a security expert need to implement to keep you safe. And so in that case, what he's really doing is he's in the business of risk management. But prior to me laying this out for you folks, none of you knew any of this. Matter of fact, I can tell you without blinking that what you hired Paul for, or what you're looking at his organization to do for you, is to keep you safe. You believe that by hiring a managed service provider, by bringing in technology and security, that tonight you can go to bed and nothing bad is going to happen to you. From an IT perspective, that can be very true because the law does absolutely without question mandate that you buy the things that Paul sells, mandate that he implement those security solutions for you because your risk profile demands it. But security is not all there is to safety, okay? Somebody asked me the other day at the conference Paul and I were at, which is more important, security or compliance? That's like saying which is more important, my foundation or my home, okay? The foundation of compliance is security, but it's not all the doors and windows. There's a lot of other things that go into this to give you guys what you're asking for, which is safety. Now, I told you in the beginning, the law is 700 pages long. I'm not about to teach everybody out there HIPAA right now, but I can make this make sense in like 30 or 45 seconds, okay? HIPAA is 3 rules. It's not 1 rule. It's not just the security rule. It's 3. The first one's the privacy rule. If you're a medical professional, you're all over this one. You know that this is the way that it determines if I go to the doctor, can you tell my spouse what happened? Can you tell other people? Can you share my information with, Walgreens, right? That's the privacy rule. And there is an audit for the privacy rule specific to that, having nothing to do with your IT. Now, security, that's Paul's job, right? Well, I mean, part of it is. In security, we actually have a couple of audits. You have two audits that are IT. So these guys down here, it's an IT risk assessment. I'm sure Paul's doing that for you right now. If not, that's a phone call you need to make rapidly. But the second one is also, it's a device audit and an asset audit. This is where he goes in and says, look, these are all the computers in your system that touch EPHI. This is what I'm doing to protect them. You're using Office 365 for your email. This is what I'm doing to protect that. Great, you did those two audits. The security rules covered, right? That is 1/3 of the security rule, folks. You have a physical audit. Think walking through your office and making sure you have clipboards facing the right way, that you have shredder boxes under the trash can. I don't know if everybody knows this or not. HIPAA requires an alarm system and it requires a fire system. So meaning that you have to at least have a fire extinguisher or you're not HIPAA compliant. Sounds weird, right? Nobody ever thinks about fire extinguishers and HIPAA in the same terms. There's an audit for that. And then there's an administrative and privacy audit. If you are a covered entity, a medical professional, what this whole thing means is you have not one, not two, but 6 annual audits that you have to do. And they're all based on these other rules. Now, the last rule over here, omnibus. It's kind of a weird word, right? Omnibus is how Paul got into this mix. Omnibus is where they created the concept of the business associate, the vendors that support you and their HIPAA compliance. Easy way to remember it, I call it the on the bus rule. See, Paul has clients on this HIPAA bus, so he has to get his butt on the bus with you. He is wrapped up into this because you're on the bus, he's on the bus. You'll never forget it once I tell you that. Guess what, folks? There's an audit for that too, right? So if you look at this and you thought going into this, hire Paul, get my cybersecurity knocked out. Yay, I'm HIPAA compliant. Who did your high-tech subtitle D privacy audit this year? I know who did his. We did. If you didn't do yours, then he didn't do yours, and we didn't do yours. How are you fit for high-tech subtitle D? And what the heck is it, right? That's why we exist, and that's the confusion in the market. Now, I told you the law mandates Paul's tools. But when Paul talks about them a lot of time, you probably are like, wow, that guy is smart. There's so much going on right there. I don't really understand this technological piece. But Paul, this kind of looks like what you actually sell, doesn't it? If you really break it down, that's your solutions. So when I say endpoint protection, the people out there are like, what? Antivirus is what we used to call this. But Paul, I'll go ahead and break out to you right now. Is the antivirus still what you're putting on? If we move past that, tell me real quick what you do there.
No, it's not just antivirus. There's breach detection as well as other cybersecurity tools.
Right. We've moved past a place, folks, where for each one of these little bars right here, Paul has one single solution and one piece of software and goes, yeah, we got this. We are to a place where cybersecurity is layered, and that's what the law is requiring. If you break it down in a nutshell, what it really says is access control. Who gets where and how? Who can touch your EPHI? Endpoint protection. How are you protecting the computers that it lives on? Monitoring and auditing. This is a big one, everybody. You have to be able to know who did what in your organization. If you have a breach, where did it come from? That tool he's talking about, that breach identification, it's used not just to stop the attack, but to tell us where it came from afterwards, to be able to go back and make sure it doesn't happen again. Network security, if you're working from home and Paul's made you work on the VPN, that's one layer of it. If you got the little firewall box at your office, that's another. But in the modern world, it's protecting you wherever you work. However, whether it's McDonald's, the hotel I'm in right now, whatever you're doing, how are you keeping the bad guys out at the network edge? And then I can't say this enough. If you have EPHI, you must back it up, okay? That means wherever it lives, you have to have multiple copies and be able to prove you can restore it. So ask a question. If you've got backups and Paul's not the one doing them, you think you're out there, you like downloaded Dropbox and it backs stuff up to the cloud. Have you actually tried to restore that stuff? You ever tested it? Have you ever gone to that external hard drive and proved that if you wanted to, you can restore the computer? Backups are only as good as your last test. That's the reason most people out there that understand this are using professionals to do it, because they're not capable of knowing. I mean, look, I think I've got a backup, but God, if the building burned down, what would really happen? If the building burns down and your backups fail, you are at fault. And that's one of the questions we're going to answer is, what happens if it's not your fault? I hate to break it to you. There was a way to do it right. And if you chose the wrong path, they're going to punish you. They're going to penalize you. Now, HIPAA is very gray. And so one of the things that happened, I don't know if everybody saw it this year, last year actually, there was a law passed called HR 7898. If you're in medical, you've heard it called the HIPAA Safe Harbor Act. I get questions about this every day, so I thought it was worth including here. This is not a law that says add antivirus and we won't find you. Do not misunderstand it at all. What it actually says is we've been begging you to implement the tools that Paul works with. We've been begging you to do this cybersecurity framework that he keeps talking about. Before, we've threatened you. If you don't do it, we're going to beat you with a stick. And it's $1.5 million stick on average we hit you with. HR 78 is a new approach. It's a carrot. The carrot and the stick, what it says is, okay, you're not listening. You're not afraid of the fine. Let's do this. We're going to double fines at everybody. In the next coming years, we're going to really increase it, make it really, really, really tough. If something happens to you, we're going to hit you hard. But if you just listen to Paul Nebb, if you just put in that cybersecurity framework, all of this will go away. The law actually says if you have his cybersecurity framework in place and an audit begins, they have to look at that and say, should we even audit these people? Can we drop this? And at worst case scenario, if it must proceed, if you have the right cybersecurity tools in place, they are legally supposed to treat you like the victim of a crime, not the perpetrator. All of it changes if you take advantage of HR 7898 and implement what is called, and this is the way they say it in the law, recognized cybersecurity practices. This is the business that Paul Nebb is in. This is the law telling you, just give him a call and make it work. But what's funny is because the way the law is written, nobody caught that. Nobody understood. They heard safe harbor and they go, I'm a good, I'm a get out of jail free card. Nothing could be farther from the truth. And this is where I come back in. So we just talked about his cybersecurity tools for a minute, and they are very important and they are absolutely critical, but they're not all there is to compliance. You may have heard of the soft side of compliance. I love it when people say that, because the funny thing is it's the side that hits the hardest. Most breaches, most fines are not caused because cybersecurity tools fail. I'm going to say something that people don't want to hear. The cybersecurity tools actually work. The stuff you see in the news is not usually because somebody broke in through this advanced cybersecurity tool and they hacked this corporation. What usually happens is the corporation had bad policies, procedures, and didn't do a risk assessment. They didn't train their employees. They didn't teach them how to work safely, and human beings screwed something up. One of the most famous breaches in mine and Paul's world last year is because this vendor literally had as their primary password the name of their company, 123, all lowercase letters. That was it. It was the whole keys to the kingdom. There's no technology that Paul can put in place. There's nothing that he can give you that is going to stop the attackers. If your IT department made your password, your business name, Dr. Smith, 123, bad policies, bad procedures, and nobody did a risk assessment. By the way, nobody trained your IT department because that's insane that they would do that, right? That's the soft side of compliance. That's why the policies and procedures exist, is to protect from the human layer, okay? Now, in case you are out there and you're like, well, what does it really look like when you say, you know, these things are happening to people? Is it really happening to people that look like me, for example? Okay, everybody out there, just jot this down real quick, Google it, whatever you want to do. HIPAA Wall of Shame. This is a database maintained by OCR. That's the Office of Civil Rights. They're the people that audit you under HIPAA. If you have a breach, if you have an incident, if you are fined, if you are found negligent, you go on this website. It's a searchable database by specialty, by your location, by your name. I can find you and you can never, ever go off of there. The reason Paul is bringing people like us in, the reason that he talks to you about your cybersecurity is because he can't have his clients on this page. He can't go here. You can't go here. It's reputationally damaging before the fine. But don't underestimate the fines, folks. The average fine issued under HIPAA is $1.5 million. And it happens to small businesses. It happens to big businesses. Some of the people that you will find on here are little bitty organizations that got fines ranging from $50,000 to $100,000 because they didn't get a medical record out in time, because they violated patient right to access. Not even because they did some big crime. They just took too long to give me my record when I asked for it. They got a $35,000 fine. HIPAA is watching everyone equally, just regardless of your size. And don't take my word for it. Search around and find the people that look like you on the wall of shame. One thing you will find, the wall of shame is not populated exclusively with doctors. So if you kind of wandered into this webinar, you're sitting here going, I'm not a doctor. Does this really apply to me? There's covered entities. So if you're a medical professional, I'm talking to you, dentists, doctors, psychiatrists, the health clearinghouses, the actual insurance providers, those are covered entities. What people think when I say medical, but business associates, the vendors that support you, Paul Nebb and Titan, your shredding company, your accountant that does your QuickBooks, your lawyer that files malpractice protection for you, anybody that you're using that can conceivably interact with your EPHI, those are business associates. And it's crazy to say this, but there's only 800,000 or so medical professionals. There's over 4 million business associates. For every doctor, there's at least 4 vendors. And all of them are under HIPAA. All of them are being fined if they do something wrong. And all of them can be found on that wall of shame. As a matter of fact, the very first vendor ever fined was a managed service provider in Philadelphia. They didn't understand what Paul understands. They didn't have their processes in place. By the way, their technology did not get hacked. An employee lost an unencrypted cell phone. Had nothing to do with technology. It was a violation of policy, procedure, and training. That's the way this works. So again, just in case you're not a medical professional, hang out for a minute. Some of this does actually apply to you. And to be clear, why is everybody looking at you guys? Why? What is the big deal about medical? Why are we not concerned with banks and manufacturing and all this stuff? They got more money than you, right? Well, they already went through this. If you're in finance, this is a 10-year-old problem. You already did this. You were penalized. You were fined. They beat you until you said, okay, I got it. And so now the financial sector has really advanced IT security. The manufacturing sector is implementing extremely advanced IT security. Medical is lagging behind. Medical is made up of so many small businesses that say, well, it's not going to happen to me, that really you become a giant target. And that target, to give you a concept of size, if you're in the medical community, you make up what is almost 30% of our nation's economy. There's 5 million small businesses that make up that sector, and you are holding a tremendous amount of data. Why would I go after a bank that has all these protections? It's kind of like, why would I try to rob a bank when I can get away with hitting 16 liquor stores? Healthcare is the liquor store. You guys are easier because your community has not caught up yet. It's been a little slower. And just for the record, the increase in enforcement is over 400% now. So if you back up 5 years ago and you go, was it really happening that much? Well, it's happening 400 times more today than it was then, and it will be again next year. Every single year, the fines increase. As a matter of fact, we actually had 5 fines in one day just in last year. Give you a couple of stats. I don't like sitting here reading through my bullet points. What I'll tell you as you guys read this over, things have changed. 5 years ago, Paul and I are like, look, guys, what's going to happen is you're going to get ransomware. If you have backups, we restore them. You're okay. So let's get Paul's backups. Let's put that in place at a minimum. Ransomware, while it's a huge risk, is only a tip of the iceberg. In many cases now, ransomware is not even the real attack. Ransomware becomes like burning down the house with the body inside. This is not a house fire. It's a homicide. They stole your data. They exfiltrated it is the word that we would use. And then they put up a ransomware attack so that all you do is restore from backups. You think you're good. You don't warn your patients. You don't tell anybody their medical records have been stolen. And the data is more valuable because people don't know and they haven't been notified. And then lastly, let's get real serious. Last year, or actually in 2020, middle of the pandemic, they started shutting down hospitals. On the West Coast, they actually shut down successfully through a ransomware attack an entire hospital in LA. What happened? Well, critical care patients had to be turned away all day long. People died on their way to other hospitals. The data was not the goal. The deaths were the goal. It was a nation-state attack damaging our infrastructure and our medical community in a critical time when they should be saving lives. It was a way to take down the U.S. infrastructure. You are that infrastructure. And by the way, this is why the enforcement is so strong. This is why the government is looking at you, because they know you're under attack. And sadly, many of your providers out there, many of the IT folks are just not doing what it takes to protect you. Now, You can look and run through stats all day. I think it's something that Paul and I do very consistently is see these kind of numbers. But the one that stands out to me here is that 30%, let's go over that one, 29% of people that had a ransomware attack said they had to let people go from their jobs. They had to cut staff. It hurt their business so much that they were unloading people. And we all know we can't hire right now, right? You know, realize how difficult it is to get staff. These people weren't let go temporarily. A ransomware took them down and the organization is on their knees. That's the goal of this thing sometimes. You are part of the critical infrastructure. And if I can't steal it, I'll just hurt you all. These are what the bad guys are doing. And I told you about 5 fines, right? So I wish I could say that every single fine, all you can get fined for is if you don't have the right training in your place and your employees use the wrong password, they're going to come in and get you. You have 30 days from the time that I ask for a medical record to get it to me. You can't charge me too much for it. You can't say I need 50 days because my building burned down. You can't say I'm out of town and I'll get that to you when I come back and let it go over. The fines you see right here are because patient right to access. You dropped the ball because you didn't understand your requirement. And if you notice, none of these are $1 million fines. These are fines that are meant to be paid, not to shut your business down completely. But Dr. Robert Glazer right there, he's going to have to pay that. I don't think he's got $100,000 that he had earmarked for the time that he forgot to get the patient their medical record in time. Had the policies and procedures been in place for him, that his organization wouldn't have had this happen. But instead, you're staring down the barrel 6 figures because somebody didn't get a medical record out in time. That's the severity of what's happening. Not here to scare you. I'm here to say this is very real and your own actions can create the problem. Now, why? Why all the policies and procedures? I got to go back to it. I said, Paul's got great tools. Paul's got great technology. And if you put them in, you've covered the security portion of part of the law. But here's the reality. I told you in the beginning, Paul's stuff does work. These hacks, these breaches, most of the time are not somebody in North Korea breaking down all the defenses and coding as fast as they can, like you see in the movies, and it's like an iRobot, right? It's not what's happening. It's usually a human being inside your organization, frankly, did something dumb. Somebody screwed up. 86% of the time, a human being caused the error. And by the way, I told you, not all IT providers are equal. About 30% of the time, 26% there, it's the IT company that actually did it, or the IT provider that actually did it, or your IT guy that made the mistake. The breaches happen because they didn't follow policies and procedures. I like to equate this to the vampire in the old movies. If everybody remembers in the old movies, you can put crosses on the doors and garlic on the windows, be totally safe. But if you invite that vampire in for dinner, you are dessert. Once you invite the vampire into your house, there's no amount of technology that can prevent you from being victim of a crime. Like this guy. Let's step out of medical for a second, everybody. I don't know if anybody out there knows who this person is, but sadly, this guy right here is famous for making terrible decisions. I don't even really think it's his fault. I think his organization failed him, and I'll tell you a little story and why. See, if you lived in Hawaii, you know exactly who this guy is. Because one day you're walking along, your phone goes off like an Amber Alert, and it says, North Korea has launched a nuclear attack against Hawaii. Basically, this is not a drill. Get under the table, kiss your butt goodbye, and text your loved ones, I'm gone. It's terrifying. People are freaking out. Total chaos. There was no nuclear attack. As a matter of fact, what Paul and I would call a script kiddie, like a unskilled hacker in his mom's basement in a hoodie, saw this guy's Facebook post. That is his public profile when he got his job as director of the Hawaii Emergency Management Software. He was so proud he put it up on Facebook, but he didn't realize right behind him is his password stuck on his screen. And if you look closely, if you look at the image on the left, there's another one stuck on the other screen. I don't have to hack you. I do not have to be into technology and break down your doors. If you put your password on your screen and post it on Facebook, a script kiddie in his mom's basement can take care of this because you fell down. But ask yourself real quick, which one of Paul's tools could have prevented that? What technology was going to stop this attack? None at all. The only thing that would save them was the soft side of compliance. See, I'll tell you why. If I'm there, I do a risk assessment, and not just an IT risk assessment, a physical risk assessment. I walk by that screen and go, wait, rip this thing off here. What is this? Do you realize that we have a policy for how you manage your credentials and a procedure you're not following? Sir, come with me. We have to retrain you. That did not take place. Had that taken place, you're not hiding under a desk texting your mom, I'm sorry, I love you, goodbye. Instead, nothing takes place because the organization would be protected by what? The soft side of compliance. The non-technical piece that you as the practice owner are responsible for implementing into your organization. The piece of it that Paul doesn't do, his part's not going to fall down, but in this case, theirs did. And it wasn't the IT department's fault. It's whoever let that guy stick his password on his screen. Okay. So what do you do? We're kind of wrapping up here. We're kind of coming towards the end of, I think hopefully everybody out there now gets what we asked in the beginning, which is, what are they going to do to you if you have a violation? What are they going to say to you if you have this breach and it's not your fault? Well, where did the breach come from? If the technology failed, it's not your fault. There's many ways to prove that you had all these things and these tools in place, and this one North Korean hacker spent months and months breaking through your firewall. Look, that's not your fault. But if you don't have the policies, procedures, administrative function training, and proof of risk assessments, then it's your fault because you're not adequately protecting yourself despite the technology put in place. Everybody, this all starts with a risk assessment. If you have not brought in Titan to look at your organization, go through all of it and tell you what you're doing right, what you're doing wrong, and what your risks are, then you are vulnerable to attack. And if you have a breach, if it's not your fault, it is your fault because you didn't look at your organization and say, how can I stop somebody from hurting me? Now, I said at one point, what if you're not in healthcare? Anyone out there, answer this question in your own mind. Is there any business in the world that would not benefit from at least once a year sitting down and saying, who am I? What do I do? How can people hurt me? And how can I prevent it? How can I protect my business? This is a universal truth. This isn't new to healthcare. A risk assessment is how you know as an organization what your risks are and how you're protecting yourself. It's why he has a career. It's why I have a career, because we can help you do this. Now, what do we do? How does Paul work with us? What is the thing that we've done for him that he's brought you here to find out? So back to my 700-page law. There are many, many ways to achieve HIPAA compliance. Guys, you can get off the call right now, call a HIPAA consultant, bring them in. It probably costs $50,000, $60,000. They will spend months of your time and stop your office and do a lot of things in there. They're very, very involved. The reality is, if you're on this call, I'm telling you right now, you probably don't need anything of the sort. What we do in combination with Paul and our partners like him, we help you achieve, illustrate, and maintain your HIPAA compliance in what becomes really about a 2 to 3 week period of just a couple of hours of time for you. So what happens is, I told you you have HIPAA coaches. We actually put you on 3 guided meetings with our coaches. You're going to sit down for an hour. They're going to go through your audits and explain them to you and help you complete them. They're going to identify the gaps that come out of those audits. What you're not doing right, that's a gap you have to remediate. That's something that has to be closed and fixed. They're going to build out your policies and procedures and customize them to your organization. One of the things that one of the smartest people I know in cybersecurity told me years and years ago, a policy or procedure you do not follow is just a list of reasons why you should be fined. So we're going to make sure that's not the case. We're actually going to make sure that what you put in place reflects how you work inside your organization. And when we're done, we're going to train your employees. And I don't mean just the little HIPAA training videos. Yes, those are included, but we're going to make them read those policies and procedures, agree to follow them under the law, say that they understand them, and we're going to date and timestamp that. So later, if it's your person that falls down, that makes a bad mistake, you can actually show under the law, we did everything that we could. It's right here. We showed Janet at the front desk what she was supposed to do. She read and said she understood it. She chose not to. What can I do? Not your fault. Lastly, business associate management. We're going to make sure you have the right BAs with everybody. You can give us a vendor list and we will go down through it and say, not a BA, yes a BA, not a BA, yes a BA. Who are you supposed to have the agreements with? And do you have them in place? Those all go out from my system and come back into it. You can always prove that if the vendor falls down, it's their fault. You have this contract that protects you called a BA, and that's why you completed it. And lastly, look, bad things happen to good people. They happen to our clients all the time. It's sad. We want to help you, but I can't prevent every single thing in the world from happening. One of these days, you may have an incident. You may even have a breach. Just having a breach or an incident doesn't mean you should get fined. We have incident management and incident response built into our program. And if you have our seal of compliance, if you use our achieve, illustrate, and maintain methodology, we issue that seal. If you have that incident, you have that breach, we are going to defend you under audit. We are going to build your response. We are going to protect you. And again, I'll say it one more time. We have a 100% success rate in protecting our clients under audit because we won't give you the seal unless I can absolutely prove that on an annual and ongoing basis, you achieve, illustrate, and maintain your HIPAA compliance. People, I hope this was educational. I know that we went through a lot. If I were to sum it all up in one space and answer the question in the beginning, look, if it's not your fault, nothing is going to happen to you. If you have the right things in place and you have the right policies and procedures, you have the right security controls from Paul, and even though you have all this stuff, something out of the blue takes you out, we can protect you. You were doing this right and you won't be fined and you won't be penalized. If you don't have this stuff in place, if you didn't do your audits, if you don't have your policies and procedures, it doesn't matter how hard you tried, how many technological tools you put in place. If something happens, you will be taken to task. It will be viewed as your fault because you left out the soft side of HIPAA compliance. Everybody, I want to thank you again for your time and attention today, especially Paul. I want to thank you for having us on. We always appreciate working with you. I really respect and admire the way that you guys look out at your client base and say, how can we protect them? What can we bring to them to educate them? You know, you stand out in the crowd, my friend. You're just not like every other IT provider out there, and I really appreciate that.
Hey, well, thank you very much, Paul, and thanks for taking the time and to join us. We had a couple of questions that came across. And I have some of these questions I can answer, but I figure let me toss them your way because yeah, they're just gonna think I'm just trying to sell them something, right? It's like, yeah, firewall, yeah, sure, you can have one, yeah. But yeah, maybe, and some of these are like myths out there, right? So like one of these questions came from practice. They say we use a cloud-based EMR, you know, everything's on the iPad, and we're basically paperless. So how does this apply to us?
Well, you know, Paul, you probably did well to throw that to me because what you know about this is probably a little deeper and you could dive way on in there. The way that computers actually work, I'm going to do it in layman's terms. Believe it or not, if you can print, you have EPHI. If you can pull it down, if there's any possibility your employees can work with it physically, like, and somebody say this to me the other day, I mean, we're basically paperless. What is basically paperless? You mean sometimes we print something here and there, but we immediately shred it, which you don't realize that's in your browser cache. That's where your computer remembers where you've been. It's also in your temporary folders. You build a copy of that on the local machine. And the last thing I would tell you is the question's not, do you have EPHI on your machine? The question from the law is, where is your EPHI and can you prove it? So the reality is you have to be able to look at the systems and know whether or not they have it, or you should assume that they do.
Yeah, without mentioning any names, you know, I went into a medical practice to help them. They asked for some help with some ordinary computer issue. And we got into talking about, you know, HIPAA compliance. And like, oh no, it's all in the cloud. And I'm like, yeah, so what's on your desktop there? Oh, that's just, you know, our patient list. I keep it there. Right. I keep it there because it's easy. All right. Well,
I have that one copy. Right.
Yeah, that's you know, the medical records and some of the reasons that hackers, you know, like medical records are because everything in a medical record is enough to steal your identity. Yep. And people, they'll take your insurance, they'll change the name, and they'll go get medical procedures done.
Yep.
And next question here. So we use an old software that requires us to use Windows XP. Our IT person tells us, you know, we've got to get rid of Windows XP, but you know, we just can't afford it. So what do you say to that, Paul? And then I'll kind of maybe throw something in there too.
I have run into that many, many times. And the solution is never, at least in my opinion, great. Spend $50,000 and buy a new EKG machine, right? I get it. I understand. Most of the time, what you're talking about is that Windows XP system is attached to some really expensive software or some really expensive machine and it just can't be upgraded. But that doesn't mean you can't protect it. People like you, Paul, through network segmentation, through virtualization of systems, there's a bunch of different ways you can do it. The answer is not, well, I mean, I've just got to keep Windows XP. Let's surf the internet on this thing that's no longer compliant. But I'm curious. You tell me what your take on that is.
Well, my take on it is a more practical and business scenario is, okay, I can't walk into a store if I need a Windows XP machine. I'm not walking into a store and getting that. Even as IT guys, yeah, there's licenses, there's downloads available, but those verification servers, those licensing servers, the updates, they don't exist anymore. And even networking protocols have changed over the years, and so even getting someone to operate and fix your Windows XP machine, it's almost impossible.
Will your remote support tools even work on XP?
I was actually thinking on it, and I'm like, yeah, okay, we could back it up, but our best image-based backup software no longer support Windows XP.
Right. Right.
So,
at a certain point, everything dies,
right? What about Macs? Are Macs like immune to HIPAA?
All right.
I'm like, if it connects to the internet.
Yes, if it is on the internet, it needs protection. And by the way, I'll go one farther. Linux is not that protected by nature either. You wonder why all these manufacturers of all this security software make licenses for Mac and Linux, right? Why would you make a product nobody needs? It's just a big misnomer. The reason that Macs get less attacks is they make up a much smaller segment of the landscape, but that segment is growing rapidly. So the attacks on Macs grow. You and I both know just last year, there were 2 or 3 major exploits for the Mac OS that if you didn't have any kind of protection on there, you were wide open.
Yeah. And this question, Paul, you kind of answered earlier, but hey, I'm just a single provider. I don't take insurance, or I'm a chiropractor. I do medical cosmetic stuff. That's
Yep.
I'm not cutting anything. I'm not drawing blood. Am I still does this still apply to me?
It's not about what you do. It's about what you have. Do you have patient records? Do you have medical records? Then this applies to you. Look, Paul, you're not a doctor. This applies to you. You're not even supposed to have the EPHI, but it applies to you. You can see it. A chiropractor at the airport that checks me in, that fills out that health insurance information, and all of a sudden I'm gonna they're not taking my insurance. They just filled out like an emergency contact form, asked me my medical history. Do I have high blood pressure, low blood? That is a medical professional, and that organization and that place must be HIPAA compliant. And I hope somebody did a risk assessment at the chiropractor at the airport. That's what I would have to say.
I actually saw one of those airport chiropractors for the first time. I passed by walking, and I'm like, oh, it's creative.
It's not the worst idea in the world.
and maybe lastly, this is definitely above me, but is there insurance that that like doctors and medical practices get that God forbid would come in and pay the HIPAA fine? Or
big misunderstanding there. Breach insurance or cyber liability insurance will help you pay for things like for our product, for your clients, we include $100,000 worth of breach insurance. It helps you pay for forensics. It helps pay for your labor to help them, get their data back. It helps to cushion the blow from a financial perspective. However, it has nothing to do with the fines issued by the government. I cannot indemnify you for committing a crime. So that would be like me giving you insurance for robbing a bank. Here, I'm going to go rob banks. I'm going to buy a policy. If I get caught, you're going to pay all my fines and get me out of jail, right? No. That's enabling a criminal enterprise. So for an insurance company to say, you know what, go ahead and violate the law. If you get caught, we're going to write a check, would make them a criminal enterprise. No chance, no way, no how.
Awesome. Hey, well, this has been really informative. hopefully our attendees, everyone who watched this got something out of it. If you did watch and you know, you're like, hey, I've got to show this to the doctor, I've got to show this to like the practice executive, we're going to have this recorded, we're going to post it to our website, to our YouTube channel. Give it 2-3 days to get up there so that just keep spreading the word, share it with your colleagues as well. This is really important information, a lot of myths dispelled here.
We try.
And that's what's really important. There's so much misinformation out there, and we just want to try to give it to you straight, make it easy, take away the pain, and help the community. I mean, it's we're local. We service businesses in our community, and we want our community to be safe.
That's right.
All right. Thanks again, Paul.
Paul, I really appreciate it. Everyone out there, be safe, be well, and be compliant. Have a great day.
Bye-bye.